Hi guys, how's it going? Today we'll be talking about bipolar disorder. Bipolar disorder is a mood disorder with the recurrent episodes of depression and mania. This usually emerges in like early adulthood, so 20 to 25 or 18 to 25, somewhere around there. Bipolar is usually that's when it's diagnosed. So bipolar, you'll have some normal functioning and then you'll have periods of illness. Um, they can exhibit like psychotic, paranoid, and bizarre behaviors during periods of mania. Um, so, what we want to do is we want to reduce mania. We want to reduce harm to self or others. We want to have one on one supervision for the client, and we want to prevent future maniac, episodes of this, bipolar disorder, like manic episodes. Guys, mania is an elevated mood, which can also describe an expansive or irritable, usually requires hospitalization. Manic episodes last for about 1 week. Then there's hypomania. This is a less severe of episode of mania that lasts about 4 days. And there's rapid cycling. Rapid cycling is 4 or more episodes of hypomania that occur within 1 year, guys. So I've known a couple. I've worked at a couple mental health facilities. I've done some clinicals at mental health facilities, and people with bipolar disorder. What I've noticed is that they're normal most of the time, and then they just have really highs and lows. Um, and sometimes they'll spend excessive money. They'll do other things that are just out completely out of normal. Um, yeah, but anyways, let's get down to it. So there's risk factors for bipolar disorder, genetics. So if you have a family member that has bipolar disorder, it's possible. Psychological, so neurobiological or neuroendocrine disorders. So if you have a neuroendocrine disorder where those transmitters aren't working as well, then that can happen. Environmental increases the stress of in like a highly stressful environment can cause this mania and depression and can cause this bipolar disorder. And now guys, if someone's gonna have a relapse, guys, alcohol, cocaine, caffeine, these can all lead to mania. So you want to avoid them. And then sleep disturbances can come before and are very associated with mania, guys. So let me explain to you guys. There's been a couple people I've met with mania, and these people, they don't sleep, they don't eat, they don't drink, and their brain is just going 100 miles an hour. They're pacing up and down the halls. They just have so much energy, and it seems like they're very anxious. But they're not eating, they're not drinking, and that, guys, that can be very harmful to those clients, to those patients. So one thing is you want to make sure they're getting enough food, getting enough water. Have finger foods. That's a big thing in the test is finger foods because they might not have, for people with mania, they don't always sit down and eat, but maybe they'll eat something on the go, they'll drink something on the go. So anyways, continuing. So guys, some more manic characteristics. Mood with euphoria. So that's euphoria is joy or like, happiness. Agitation or irritability. Restlessness, guys, big time restlessness. Flight of ideas. Continuous speech with sudden and frequent topic change. So guys, they're going 100 miles an hour. They're talking. And then grandiose view of self and abilities. Guys, grandiose means like you see yourself as a god. You're more powerful, and you think like jumping off a 20-foot roof won't hurt you. That's like being grandiose. That's just an example, but you think that you're you're all powerful, you're not going to get hurt, nothing bad's going to happen to you. Impulsivity, guys. Impulsivity is the big one. Impulsivity, like spending lots of money, giving away money or possessions. Manipulative behavior, distractibility, decreased attention span, poor judgment, attention-seeking behaviors, flashy dress, impairment in social and cognitive functioning, impairment in social occupational functioning, decreased sleep, guys. Decreased sleep is a big one. A lot of these guys will only get 2 or 3 hours of sleep. Neglect on ADLs, including nutrition and hydration. So guys, what happens when you don't have enough nutrition and hydration, guys? You're going to be weaker, and that is going to increase that mania. So you want to make sure they're getting enough nutrition and hydration when they're, in mania. Possible presence of delusions and hallucinations, denial of an illness. So some depressive characteristics of bipolar disorder is flat blunted, tearfulness, crying, lack of energy, anhedonia, which is lack of pleasure, lack of interest in activities, physical reports of discomfort and pain, difficulty concentrating, suicidal ideation, decrease in personal hygiene, loss or increase of appetite and disturbed sleep, and psychomotor retardation or agitation. And guys, I've actually, if you're a normal person, you've never seen any of this stuff, I've worked in mental health facilities, and guys, this happens. It happens, So what you can do is there's mood disorders questionnaires. You want to give that to them. And now let's get to the mood stabilizers, guys. And so that's lithium carbonate, guys. So you give lithium, and this can help stabilize mood, prevent mania, and help with, bipolar disease. You can also administer first-generation antipsychotics or second-generation antipsychotics and antidepressants, because bipolar is a disorder of, depression. And this is the other crazy thing, is you can do electroconvulsive therapy, ECT therapy. So guys, this is where they shock the brain. And basically how my teacher explained it is, if you turn off a computer and turn it back on, like resetting a computer, that electroconvulsive therapy is like the same thing for us, as a computer, resetting a computer, right? So you do shocks to the brain, and that can, help reset the brain. To me, that seems kind of extreme, and I've never seen it done. And there's, a big medical team around these people that do the, electroconvulsive therapy. Back in the olden days, they tested this, and it actually worked on people. But, I'm not I don't know much about that to be telling you, but I do know that's what they teach us in school. So now let's get, guys, this is the big thing, is lithium. We want to focus on lithium. That's the biggest thing for bipolar disease. And let's just talk about lithium. So lithium carbonate. So guys, lithium helps with the brain. It helps those neurochemical changes occur. It includes serotonin receptor, and lithium can increase neuronal growth. So lithium can help with bipolar because those neurotransmitters are going to work better, can increase their mood, they can be happier. But the thing with lithium is you want to get a lot of blood draws. The reason is because you want the lithium level to be 0.6 to 1.2. And if you see adverse effects, like nausea, diarrhea, abdominal pain, tremors, polyuria, weight gain, renal toxicity, goiter, hyperthyroidism, hypotension, electrolyte imbalances, those are all complications of lithium, right? So it can definitely help you, but there's also a lot of side effects and complications that can occur. So guys, when a lithium level is above 1.5, that's an early indication they're going to have mental confusion, sedation, poor coordination, coarse tremors, and ongoing GI distress, including nausea, vomiting, and diarrhea. So you guys want that level to be 0.6 to 1.2. That's a good, healthy rate of lithium levels in the blood. If it gets above that 1.5 or even that 1.2, you can start seeing these, mental confusion, sedation, and whatnot. And you're supposed to withhold the medication when this happens. You don't want to give them more lithium because that's going to cause more lithium toxicity, and that can be dangerous. The next thing, guys, is lithium interferes with sodium and usually secretes sodium. So you want to make sure you have adequate intake of fluids and sodium while taking lithium. And that's also including, you want to avoid super extreme hot weather because you're going to be sweating a lot. You want to make sure you're getting adequate water and sodium and not, doing extra, too extraneous, like too hard of workouts. Because that's going to cause that lithium and that sodium to deplete in your body. Guys, the next lithium level is 2.0 to 2.5. That's going to be extreme polyuria of dilute urine, tinnitus, that's ringing in the ears, giddiness, jerking movements, blurred vision, ataxia, seizures, severe hypotension, and stupor leading to coma, and possible death from respiratory complications. Now, guys, I don't want to be the person, I didn't want to know how they figured this out, because obviously someone had to go through these symptoms for them to figure out that that level was very toxic. That must have been in the olden days, and I'm glad that we don't have to go through that, and I'm glad we've learned from having that high of a lithium, it can cause those problems. So, guys, when you're at 2.0 to 2.5, your body's saying, hey, get this lithium out of me, because it's just so high. And that's going to cause extreme polyuria, guys. Polyuria is urine. Poly means a lot. Urea means urine, so lots of urine. Your body's trying to pee out that lithium. Guys, and obviously you would withhold the lithium. You don't give it to them. And what we got to do is you can use mannitol and aminophylline may be prescribed to increase the rate of excretion. And you might have to do gastric lavage, which is basically getting all that fluid out of you. The next one is severe toxicity, guys. So lithium level greater than 2.5. So that's rapid progressions of manifestations leading to coma and death. So hemodialysis can be warranted. So guys, when you get 2.5, you're going to go on dialysis because dialysis is going to clean your blood rapidly, get rid of that lithium, and but this is very dangerous. It can even lead to death. So lithium is pregnancy risk, category D, so it is considered tetragenic, which is basically not good for the baby. And this is breastfeeding is contraindicated. And clients that have cardiac disease or severe kidney disease, hypovolemia, and schizophrenia. So lithium is contraindicated in clients who have severe renal or cardiac disease, hypovolemia, and schizophrenia. So guys, let's get to the nursing administration. So you always want to monitor plasma level of lithium. Older adults can have increased risk of toxicity because their liver and kidneys aren't working as good. As you get older, as you age, those things slow down. So you want to make sure those older adults don't get too much. And yeah, you just want to make sure those ranges are good. Lithium is very important for bipolar disorder. So anyways, guys, thanks for watching. If you like learning, subscribe. Thanks.